Welcome to EMT Essentials by Bilal. In this presentation, we'll explore the most essential emergency drugs used in pre-hospital and emergency room care. You'll learn about their indications, doses, routes of administration, and easy-to-remember mnemonics. Let's begin your quick and practical guide to mastering life-saving medications. Emergency drugs are powerful, life-saving tools used in critical situations. But their effectiveness depends on how accurately we use them. That's why knowing the correct dose, route, and timing is absolutely essential. As EMTs and medical professionals, our decisions can save lives or cost them. So let's learn with clarity and confidence. In emergency medicine, drugs are grouped based on their life-saving role. We'll cover the most critical categories. Cardiac resuscitation drugs, used during CPR. Respiratory support drugs, for managing airway and breathing. Analgesics and sedatives, to relieve pain and calm the patient. Anticonvulsants, for seizure control. Anti-allergy and anaphylaxis drugs, like epinephrine. Hypoglycemia management, including fast-acting glucose solutions. And finally, emergency antibiotics, for severe infections. Let's explore each one in detail. Adrenaline, also known as epinephrine, is one of the most essential emergency drugs. Remember the mnemonics AAA, arrest, allergy, asthma, these are its key uses. In cardiac arrest, we give 1 mg for or IO every 3 to 5 minutes, using the 1 to 10,000 concentration. For anaphylaxis, the dose is 0.3 to 0.5 mg intramuscularly, with a 1 to 1,000 concentration. Routes of administration include for IM, IO, and even ET, endotracheal. Always double-check the concentration and route to avoid dosing errors. Amiodarone is a powerful antiarrhythmic drug used in life-threatening ventricular arrhythmias like ventricular tachycardia and ventricular fibrillation. Remember the mnemonic, AMI means antiarrhythmia. In cardiac arrest due to VT or VF, we give 300 mg for bolus, followed by 150 mg for after 3 to 5 minutes, if needed. It's administered intravenously only. Always monitor the patient closely, as amiodarone can affect heart rate and rhythm significantly. Atropine is essential in emergencies like bradycardia, asystole, and organophosphate poisoning. Use the mnemonic ATRIP to recall its actions. A for asystole. T for toxins like organophosphates. A for rhythm control. I for route. And P for poisoning. The standard dose is 0.5 mg for every 3 to 5 minutes, with a maximum total of 3 mg. It can also be given intramuscularly or via endotracheal tube if access isn't available. Atropine works by increasing the heart rate and blocking parasympathetic activity, making it a frontline drug in bradycardic emergencies. Salbutamol, also known as albuterol, is a fast-acting bronchodilator used in asthma and COPD attacks. Think S for shortness of breath to remember its purpose. The typical dose is 2.5 mg via nebulizer, repeated every 20 minutes for up to 3 doses in acute settings. It can also be delivered through an MDI, a metered dose inhaler. Salbutamol works by relaxing the bronchial smooth muscles, allowing airways to open quickly. It's a go-to drug in pre-hospital and ER respiratory support. Ipratropium bromide is used to treat bronchospasm and COPD exacerbations. It works by blocking the parasympathetic nervous system, helping to relax the airway muscles. The standard dose is 0.5 mg via nebulization, and it's often combined with salbutamol in what's called a duoneb, providing a stronger, synergistic bronchodilation effect. Remember, ipratropium adds power to your puff, especially in stubborn or mixed respiratory cases. Hydrocortisone is a steroid used in emergencies like severe asthma, anaphylaxis, and adrenal crisis. It reduces inflammation and supports the body's stress response. The emergency dose is 100 mg for bolus. Think of the mnemonic hydro equals hormone support, as it replaces or boosts your body's natural cortisol when it's overwhelmed during critical illness. Morphine is a powerful opioid used for severe pain and myocardial infarction. That's why we remember LEM for MI and morphine. The emergency dose is 2 to 5 mg by slow 4 push, and it can also be given intramuscularly. Always monitor the patient closely, as morphine can cause respiratory depression, especially in high doses or when combined with other sedatives. Diazepam is a benzodiazepine used in seizures, anxiety, and for sedation in emergency settings. Think DIA equals down seizures to remember its calming effect on the brain. The usual emergency dose is 5 to 10 milligrams, given 4 IM, or even rectally if for access is difficult. Always watch for respiratory depression and drowsiness, especially in elderly or compromised patients. Midazolam is another powerful benzodiazepine used for seizure control and procedural sedation. Think MID equals minimal seizures to remember its role in calming brain activity. The typical dose is 2 to 5 milligrams, administered via 4 IM or intranasal routes. It's fast-acting and especially useful when quick sedation or seizure control is needed, but always monitor for respiratory depression. Diphenhydramine, commonly known as Benadryl, is used in allergic reactions and as an adjunct in anaphylaxis. Remember it with D for drug allergy. The standard dose is 25 to 50 milligrams, given intramuscularly or intravenously. It's an antihistamine, so watch for sedation as a side effect, especially in pre-hospital settings. Dextrose 50%, or D50, is a key emergency drug for treating hypoglycemia, a dangerous drop in blood sugar. Remember it with the shortcut, D for diabetic drop. The typical dose is 25 to 50 milliliters as an 4 bolus, pushed slowly to avoid vein irritation. Always check blood glucose before and after giving D50 to confirm improvement. Glucagon is a life-saving emergency drug used when blood sugar drops dangerously low and for access isn't available. It also helps in beta-blocker overdose. The usual dose is 1 milligram, given IM, 4, or subcutaneously. Mnemonic, glucagon, as in gone low sugar. It helps raise glucose fast, especially in unconscious diabetic patients. Naloxone, also known as Narcan, is the go-to antidote for opioid overdose. The dose is 0.4 to 2 milligrams, given 4 IM, IN, or subcutaneously, and it can be repeated every 2 to 3 minutes as needed. Mnemonic, N for narcotic reversal, it rapidly reverses respiratory depression caused by opioids like morphine or heroin. Ceftriaxone is a broad-spectrum antibiotic used in cases of suspected sepsis or severe bacterial infections. The typical dose is 1 to 2 grams, administered either 4 or IM. Mnemonic, Cef equals septic shock saver, it's a first-line defense when seconds count in fighting life-threatening infections. Let's wrap up with some critical emergency mnemonics. White heavy check mark naval, these are the only drugs that can be given via the endotracheal, ET, tube. Naloxone, atropine, vasopressin, epinephrine, and lidocaine. Remember, if there's no 4, give naval via ET. White heavy check mark 6 rights of drug administration, the golden safety checklist. Right drug, right dose, right route, right patient, right time, and right documentation. Always double check before you push that med. Before wrapping up, here are some common medication errors you must always avoid in emergency care. No entrosine wrong dose or route, double check the drug guide or protocol before administration. No entrosine using expired medications, always check the expiry date before preparing any drug. No entrosine misidentifying indications, make sure the clinical scenario matches the drug's use. No entrosine skipping documentation, if it's not written, it didn't happen. Always record the time, dose, and your initials. Repeat button remember, check, confirm, document, repeat. That's how you save lives safely.